Good afternoon. Thank you for inviting me here today to speak with you. I'd like to talk to you about childhood obesity. Do you have a child who is overweight? Do you have a niece or nephew who's overweight? Chances are you do know a child who is struggling with childhood obesity. Research suggests that childhood obesity is at epidemic proportions because children are not physically fit, parents are not providing nutritional meals, and stakeholders such as federal and local governments and healthcare professionals are not providing preventative programs or resources. At Johns Hopkins Bloomberg School of Medicine, Tree B. Brown conducted a study, and his study concluded that obesity is at an epidemic level, and the number has tripled since 1980, and that is children who are obese. Children who are obese in their teen years often become obese adults, and that is a leading cause of many chronic illnesses, including diabetes 2, heart disease, and even early mortality. Today's children between the ages of 2 and 19 are not exercising enough. In 2012, the Department of Health and Human Services issued a report with guidelines that says that children must exercise 60 minutes every day, and that's aerobic activity. Included, or not included, children must also perform some kind of strength-building exercises, and that's every day. Exercise is difficult in our built environment. Inner city areas just simply don't have easy access to parks. Parents must take children out of the city limits to hike or bike, and parks are just not easily accessible to children. Schools used to be an ideal place for children to exercise, but unfortunately, with the budget cuts today, schools with limited discretionary income have cut team sports and after-school activities and physical education classes. Families also, due to the economic downturn a few years ago, have had to cut after-school team sports such as Little League, basketball, soccer. Children just are not getting the exercise that they need to. Also, parents do not always provide nutritionally balanced meals. Many Americans exceed the recommendations made by the U.S. Department of Agriculture. Children are eating too many high-fat processed foods, such as the fast food restaurant. Parents are busy today. Both tend to work outside the home. It's easy to stop by and drive through the drive-thru and buy a Big Mac or a Happy Meal. These foods are loaded in fat, notoriously so. The ad campaign for Super Size Me was terrible to Americans' waistline, and all that affects children. It's too much food, too high fat content. Additionally, meals in restaurants. You can try and order a meal off the child's menu, but it's loaded in calories. It's often fried food, fried chicken fingers, or French fries. All these calories add up. Parents must be aware also of portion control and servings and food groups. In 2012, Dietz and Stern created this guideline that helps parents identify the food groups, how many servings per day, and what the portion is for each age group. This is a great resource. I invite you to search the internet to find this resource and use it in your home. Parents need to know what children are eating in school. School lunches are not meeting with the U.S. Food and Drug Administration's guidelines. Many struggle to meet those guidelines. Additionally, there's the vending machines. Vending machines are loaded with the best sellers, the candy, the soda, the chips. These are all extra calories that keep adding up throughout the day. Stakeholders, such as our federal and local governments, must combine their efforts to support the community. Programs should be designed that are geared towards fitness and nutrition education. Funds need to be directed to programs that focus on a healthy lifestyle balance. Community centers, maybe they can offer programs such as family biking weekends or hiking weekends where the family gets together and exercises as a group with their community. Or perhaps having cooking demonstrations in their kitchen, inviting sports celebrities or local commentaries, people in the community that also help educate and support parents' choices to give their children a better balanced diet. Also, federal agencies need to pass more regulations on the food industry. The labels on cans and products are not always accurate and sometimes difficult to interpret. Is that 70 calories for 3 servings, or is the whole thing 70 calories? Healthcare professionals also should better educate parents. They should help them define body image and the effects of obesity. In conclusion, childhood obesity is at an epidemic level, and parents as well as federal and local community leaders must help children to lead a more balanced lifestyle by promoting exercise and education and healthy food choices. To summarize, our children are not physically fit. Parents are not providing nutritionally balanced meals, and stakeholders must join together to ensure focus is directed towards physical fitness and nutrition educational programs. In closing comments, today, obesity in children and adolescents is a critical medical and social issue. Studies indicate that obesity is at an epidemic level, and clearly food choices and lack of exercise are the blame for the dramatic increase in childhood obesity. Obesity can be deterred and even prevented and reversed if measures are taken now. If stakeholders, educators, and parents work together to ensure community-based programs are geared toward increasing a child's physical activity and provide information on better nutrition, they can be assured that children will live longer, happier lives, and medical costs associated with these illness-related diseases will be reduced. Thank you very much.